I'm Chet Lehman. Here's a look at your local news headlines. Several structures at Arway Lumber in Livingston went up in flames yesterday morning. Also injured 2 people, one of them seriously. Fire department officials say it started with an explosion from sawdust in one building that quickly spread to 3 others. According to RY Timber website, the facility makes about 16% of the lumber manufactured in Montana. That mill also produces more than 60 million board feet of lumber per year and employs more than 85 people. Representatives from ROI say damage from the fire will not halt production and no jobs will be lost because of that fire. Also, there's another Montana fire to add to the smoke in the air. South of Ennis, the Sunrise Fire burns on both forest and private land. It's estimated to be about 100 acres. It was discovered earlier this week, 40 people on the ground fighting that blaze, along with 4 engines, 2 helicopters. Additional resources have been ordered to minimize growth on the private land. And after 2 years of construction, the Billings Clinic facility in Bozeman ready to open its doors this morning. Billings staff, which has been working in remote locations, will now be under one roof. They'll be joined by many newcomers. The clinic says it has already hired around 200 people, still looking to hire 60 more. The outpatient surgery center will also be at the clinic, and that will open its doors in early October. At the state capitol yesterday, the State Office of Public Instruction gave lawmakers a closer look at some of the educational gaps that still remain among students in Montana. For Native students in the 2021 school year, 55% of reading scores on the Smarter Balance test were in the novice category. That's compared to 24% for non-Native students. In math, 64% of Native students scored in the novice category, compared to 29% for non-Native students. And graduation rates for Native American students were down slightly last year. The report also shows a large gap in test scores between schools in low-income areas compared to other schools. That's a look at your local news headlines. I'm Chet Lehman. Have a great day.
Billings Clinic has been under construction for the last 2 years now. As the doors are ready to open to the public on Tuesday, it's ready to welcome the community inside.
Hey, how you doing? With a project of this size, you know it's going to take time.
A long time coming for Billings Clinic, adding services to a fast-growing area of Bozeman off of Valley Center Road and I-90.
They want to help meet the growing healthcare needs of the Bozeman community.
Staff, which has been working in remote locations, will now be under one roof.
Through a friend of mine that I fly fish with. So I saw the opportunity to both continue my outreach and collaboration.
Ahead of the opening, staff say they've hired approximately 200 people. With staffing shortages being at the forefront of the community, they still have the ability to hire around 60 more people.
Just in general, staffing is a challenge. We've had really good response.
Officials say they will still work with Bozeman Health on areas such as emergencies and labor and delivery.
So we're here to add to the mix and collaborate with the existing providers and care teams.
A grand opening ceremony for the public takes place on October 15th, but Dr. Rice says he's already looking forward to seeing patients and his co-workers starting tomorrow.
And have my colleagues to be able to run down the hall and ask a question.
The surgery center behind me will open its doors by October, just in time for the grand opening ceremony. In Bozeman, Edgar Cedillo, MTN News.
Well, as the old song goes, smoke gets in your eyes. Well, that's true for people in Butte and in southwest Montana, as the air quality is very poor from all the wildfire smoke that is settling here in the valley.
Right now, I mean, we do have some major fires in Oregon that are traveling up when we get that southwest flow, but we also still have that major fire by Salmon, Idaho. A lot smaller fires in Idaho and also in western Montana.
Butte's air quality was rated as unhealthy as of Monday, meaning that prolonged exposure to the air could be harmful to anyone.
Certainly people who have asthma or other lung disorders could have an exacerbation of that disorder. But even for healthy folks, you can have some allergy symptoms, some difficulty breathing.
Health officials suggest making your home a clean air space with good air filters and keeping doors and windows closed.
The best thing you can do is stay inside. So minimize your exposure to all of that smoke. And also when you do have to go outside, try not to be, exercising or doing any vigorous activity.
The smoky air did not prevent the Burks from their daily walk regimen.
I'm in my 80s, and So, you know, it kind of bothers you a little bit, but we just kind of ignore it. Yeah, you wouldn't want to go for a 4-hour hike or anything like that.
Folks here in Butte have a way of judging the air quality just by sight. If you can't make out the details of the Our Lady of the Rockies statue on the East Ridge, or if you can't even see the Highland Mountains south of Butte, then you know you've got a poor air quality day.
This is one of the worst days that we've seen. It's really dense all over to the south. And it was nice over the weekend, but today it's coming in pretty good.
Health officials are hoping the cooler temperatures and winds will push the smoke out of the area soon. In Butte, John Amy, MTN News.